Community medicine, the essence of primary health care. That is the seemingly simple yet very loaded title of this conference organized by the Philippine Academic Society of Social and Community Medicine, together with the University of the Philippines College of Medicine through its community-oriented medical education unit. As we start this event, allow me to break down the important terms in the title, namely community, community medicine, and primary health care. There may be a lot of variations in the definitions of these terms, but allow me to refer to the older definitions way back from 60s and 70s, and also borrow words from Dr. Willoughby Latham in his 1979 book, The Future of Academic Community Medicine. First, community. When we talk about community, we may refer to an interdependent group of persons residing permanently in a geographically determined area where they share a common culture and spend most of their daily life. But I would like to point out what Dr. Latham added, that when we speak of a group as a community, it should have the characteristic of having a clear awareness of common good as a duty. Common good as a duty. This means that the main practical consequence of belonging to a community is the informal obligation to think and act for promoting the common good. We hope that we can keep these in mind when we approach our communities, as it could have implications on whether we are just going for outputs or aiming for outcomes and impact. If that's the definition of community, now what is the second term? Community medicine. Now, a forum in Rockefeller Foundation in Bellagio, Italy, attended by international educators of health professions sometime in 1968, so wala pa po tayo nun, defined community medicine as that branch of medical science that is concerned with the health needs and conditions of population groups. Aside from this definition, I also appreciate the definition of Dr. Latham, which defines community medicine as the application of medicine and other sciences, especially social sciences, by professionals and auxiliary personnel jointly with community members or groups to improve the health level of communities. Thus, if we refer to these definitions of community medicine, we see that it is a branch of medicine that is not limited to be practiced by a certain group of doctors of a certain specialty, but rather a discipline that can be practiced by physicians regardless of their field or discipline. After all, if we truly are concerned with the health of communities and populations, and as we move towards universal healthcare in its true essence, then we should realize that all of us has a role to play. Thus, there should be no monopoly in trying to achieve health for all. Health for all. That leads me to the last and third term, which is primary health care, that we can trace back to the Alma Ata Declaration of 1978, which is still very relevant today. So, what is primary health care? Sadly, in this digital generation, when we Google the term primary health care, what you will usually see are definitions that would point to a level of care or essential health packages. Let us emphasize that primary health care extends far beyond just managing illness, and primary care is just one aspect of primary health care. Note that while they are related, primary health care and primary care are not the same thing. As the overarching principles to which health for all is anchored, we should know that primary health care is more than just primary care. And we hope that these very basic principles would not be confusing to our learners and educators alike. However, it is actually because of the seemingly persistent confusion and other gaps in teaching primary health care and community medicine concepts that even prior to the mandate of the Universal Healthcare Law to reorient health professional education curriculum towards primary health care, we in PASCOM have been pushing for the integration of the PASCOM 6 pillars of primary healthcare practitioner, which was launched during the 2017 PASCOM General Assembly. In the 6 pillars, we propose that a primary healthcare physician is a general physician who applies the principles and approaches of primary healthcare under the Alma Ata Declaration of 1978. Thus, the primary healthcare physician is one that exemplifies the following outcomes: upholds the right to health and works towards its realization, addresses the social determinants of health through intersectoral collaboration, advocates for the primary healthcare approach, guarantees genuine community participation in all levels of interventions, utilizes the health systems approach, and provides quality, comprehensive primary and first contact care. Since the 2017 PASCOM General Assembly at the University of the East Ramon Magsaysay Memorial Medical Center that launched the PASCOM 6 pillars of primary health care, most, if not all, of our conferences have been themed under those 6 pillars of primary health care. In this conference, we will dig deep into 4 of the 6 pillars, namely health as a right, community engagement, social determinants of health, and health systems approach. As I end this welcoming message, allow me to thank and acknowledge our partners and key stakeholders. Thank you to the Association of Philippine Medical Colleges through its president, Dean Madeline Sosa, and the APMC Board of Trustees for their continued support to PASCOM in our endeavors towards integrating primary healthcare in the medical curriculum. Thank you to the University of the Philippines College of Medicine Community-Oriented Medical Education Unit through its head, Dr. Lia Palileo Villanueva, for being our host and CPT provider for the past 3 years and hopefully counting. Thank you to the PASCOM executive officers, especially our Vice President and Head of CPD Committee, Dr. Rico Opinatan, for taking the lead in organizing this event. Thus somehow allow me to perform functions to formalize the organization. Of course, thank you to the deans of medical schools, department chairs of training institutions, faculty, consultants, residents, and students for supporting and joining us in this endeavor. Lastly, and most importantly, thank you to our partner communities who we have been working with and serving as an inspiration in learning, teaching, and practicing. Community medicine, the essence of primary healthcare, is the first annual conference of PASCOM since its recent incorporation and registration as a nonprofit organization. Thus, all of us here are now part of this history and milestone in community medicine education. And we hope that this historical experience will be meaningful for all of us. Maraming salamat po. Mabuhay ang PASCOM. Mabuhay ang ating mga komunidad.